and happy birthday to you.
Thank you very much. First, can you hear me clearly? Am I
Yes.
clear? Brilliant, brilliant. Thank you. Well, it's an absolute pleasure to be joining you, particularly on my birthday. In fact, I think it's great to be involved with such a great setup. Thank you for that introduction. So yes, I'm a GP. I am based in North London, and I have a genuine interest in diabetes, which started off by seeing patients in my practice, but also with family members affected by the condition as well. And as part of that, when you're living and around people who are living with diabetes, particularly type 2 diabetes, one of the topics that often comes up is, can I reverse this? And can I even cure myself having diabetes? So that's why I thought that would be a particularly interesting topic to talk about today. And I think not a day goes by without looking on the internet or having a WhatsApp message forwarded where someone's talking about how they reverse their diabetes. So I thought that would be a really good topic to talk about. So over the next 10, 15 minutes or so, I'm just going to give a flavor from a GP's perspective of whether we really can reverse diabetes. So let's start off with diabetes in itself. So there are two main types of diabetes, and today we're going to be focusing on type 2 diabetes because that's the type of diabetes that potentially could be reversed. So type 1 diabetes is less common, affects about 10% of the population, and is an autoimmune condition where someone's pancreas is unable to produce insulin. So very early on, this tends to affect younger people, and they start using insulin as the main management. Now, that type of diabetes we know cannot be reversed yet. We don't have a cure for it either, and so that's not what we're going to be talking about today. But the other much more common type of diabetes is type 2 diabetes. And this is a condition that affects about 90% of people who live with diabetes. And it is characterized by having genetic and lifestyle factors that result in fat being deposited around someone's liver and pancreas, which then affects the way in which their insulin functions within their body. And you may have heard of the term of insulin resistance, and that is exactly what is happening in type 2 diabetes. And that's being driven by this fat that is covering the liver and the pancreas. So that's why being overweight and in fact having is so closely linked to type 2 diabetes. So those are two different types of diabetes. Now, type 2 diabetes is what we're going to focus on today. And when we talk about reversing diabetes, when you see these headlines and YouTube videos about I reversed my diabetes, well, what do we actually mean by reversing? If you speak to a clinician, so a GP or a pharmacist or a nurse who deals with people living with diabetes, we actually phrase it as remission, diabetes remission. And the reason we use that terminology is because this is something that isn't necessarily permanent. Yes, you may be able to temporarily reverse aspects of your diabetes, but it isn't necessarily that something that will remain permanent. There's always a risk that it could come back again. So we're going to delve a little bit deeper into that. So when we talk about remission, diabetes remission, what we mean as doctors and nurses and pharmacists is that a person is able to reduce their glucose levels to essentially a normal level. And you can speak to your GP about what a normal level is. Essentially being able to reduce your glucose to a normal level without needing diabetes medications. So this is not about reducing your glucose with diabetes medications. It's about whether someone can actually have a normal glucose level without the need for any medications, and to maintain that for a number of months. We say at least a minimum of 3 months. So that's what we mean by diabetes remission, people with type 2 diabetes. And as I mentioned, that certain factors are really important to maintain that glucose level. If not, then the glucose levels will increase. And again, once again, the person will have full-on type 2 diabetes. They will no longer maintain that remission. So why do we want to reverse diabetes? Well, one of the main things that a lot of my patients say to me is that we don't like taking medicines. We don't like the thought of having to take pills every day and having to have all of that hassle and stress, potential side effects from medications affecting people as well. So that's the first thing that my patients say to me straight away. I want to reverse my diabetes, but I don't want to be taking medication. Okay, fine. But from a medical perspective, we know that reducing your glucose levels if you have type 2 diabetes can actually, in the long run, reduce the complications. Now, we know that when glucose levels are more controlled, there's a lower risk of complications to the eyes, to the kidneys, to the nerves, and potentially also to complications such as heart disease and strokes. So we know lowering glucose levels is really important, whether you're able to lower it to a completely normal level or just better than it is right now. We know that has an impact in the long run. So what is the evidence? Why do I even think about remission in people living with type 2 diabetes? There was an excellent study in the UK, and we're very proud actually that the University of Newcastle had a study called the DIRECT study. And if you want to learn more about diabetes remission, please do look this up online, the DIRECT study, in which they took people who were living with diabetes in their first few years of having been diagnosed with type 2 diabetes and put them on a very low calorie diet. That means calories of around 800 kilocalories a day, which is probably about a third of what most of us normally consume in terms of calories each day. And they maintained that for a period of 3 to 5 months. And during that time, people had significant weight loss. We're talking about weight loss in the region of 10 to 15% body weight reduced within those 3 to 5 months of having that very low calorie diet. And then they were gradually reintroduced to having a normal, healthy diet. And that's a question that we often get asked about, what is a normal, healthy diet? And so they had dietitians and psychologists motivating and educating these people as they kind of came back into a more reasonable diet that they could continue in the long run. And what we found after a year is that people who reduced their weight significantly through this calorie restricted diet and healthier diet, a lot of them were able to normalize their glucose levels without the need for medications. We found that people in particular who lost more than 10 kilos or 10% of their weight or even 15% of their weight had a greater chance of having normal glucose levels. So that's probably the key study that I would direct you to if you're interested in looking at the evidence behind it, the DIRECT study that was conducted in Newcastle. And essentially that weight loss helped reduce that fat around the liver and the pancreas, which helped improve people's insulin sensitivity, and their insulin just helps essentially control their glucose levels a lot better. Now, that was one study. In the real world, people are able to go into diabetes remission through a number of methods. Key to it all is the weight loss. So either through a healthier diet, through good exercise and regular exercise, lifestyle changes beyond that as well. And it's usually a combination of all of these three things that can result in weight loss, which can then get us closer to having a normalized glucose level. I'm not going to talk about the types of diets in detail, but this is certainly something that if you're interested in, to discuss with your GP. And there are a number of different diets that you don't have to be extreme like they were in that study where they were consuming 800 calories a day. There are other types of diets, lower carbohydrate diets, lower fat diets, intermittent fasting. There are a number of diets that might be able to suit your lifestyle. They may not result in as drastic a weight loss and as quick a normalization of glucose, but in combination with exercise and other good lifestyle factors, it can slowly get you towards that normalization of glucose. It's important to remember, though, that this may not be appropriate for everyone. Now, we found in the studies as well that people who have recently been diagnosed with diabetes within the last few years tend to be more successful in this reversal process. But also people who have more complications of diabetes, perhaps they're already taking insulin with their type 2 diabetes, or they've had a heart attack or a stroke and they're more frail, well, they may not be so suitable to these more extreme management options of reducing weight drastically and going into diabetes remission. So it is very much on an individualized level. That's why it's so important to discuss this with your GP to see whether you may be able to have one of these particular diets to really try and get you to reverse these diabetes processes. However, even if you're not able to be put onto one of these diets that I've mentioned or programs, there are still lots of options in terms of improving our diet and exercise and our lifestyle, which will still help to reduce glucose levels enough to reduce some of the complications of diabetes. So it's still all worthwhile. It's just that not everyone perhaps will be able to go to a completely normal glucose levels without medicines. So in terms of success stories, I've seen patients of mine who didn't even go on an extreme, very low calorie diet, but just made adjustments to their diet, their exercise, their lifestyle. I know one patient in particular, his main focus was reducing the portion size. So he would still eat most things, but his portions would be better controlled. And that's one of the easiest things to do in essence, because we're not having to think of how much carbohydrate do I have? How much fat do I have? How much protein do I have in this meal? But if we just think about reducing the sizes of our portions a little bit, that's the first step to take. He also started exercising a lot more. The recommendation by the government is by the Department of Health, is to exercise, have moderate activity up to 150 minutes per week. So that's exercise that gets you a little bit out of breath and a little bit sweaty. And that's exactly what this patient of mine did. And by doing that for about 6 months, we actually found we could stop most of his diabetes medications. And he came to me right at that 6-month mark and asked me if we could stop his final diabetes medication. And we tried it, and he maintained all these lifestyle measures, and his glucose levels remained normalized. We still remained careful, though. So even with these success stories where people are able to normalize their glucose levels through these measures, we still have to monitor them on an annual basis. They still need to come and see us at the GP practice to check their blood pressure, check their bloods, check all of their other factors as well, their weight, because as I mentioned at the top of the program, these changes to lifestyle are sometimes difficult to maintain. And we do sometimes see people putting on a little bit of weight after a bit of time. Maybe a stressful occurrence happens in their life where they can't maintain these lifestyle measures, and then their glucose levels start to rise again. So it is important that even for people who are successful in reversing and going into remission, to maintain their annual checks with their GPs. So as I mentioned, there can be challenges with this. It can be very rewarding. But the one thing I'd finish off with really here before we go to some Q&As is that the management of type 2 diabetes has changed in the last few years. About 10, 15 years ago, GPs would talk about type 2 diabetes as being a progressive condition that would gradually, month on month, year after year, potentially get more challenging and more complicated, and more medications being needed to manage it. However, with this new data that I discussed and these new options of putting diabetes into remission, we're giving people real, genuine hope that they can live with normal glucose levels without having to take medications for the right person, and still requiring monitoring. But really, that can be an absolutely life-changing experience for people. So managing diabetes has changed a lot. Type 2 diabetes is no longer the life sentence that sometimes GPs used to say to patients maybe 10, 20 years ago. It's very different. So I've tried to really summarize some very technical areas, and I apologize if I've not gone into the details that perhaps you wish, but we now have a Q&A session, I believe, and I'm happy to answer your questions. But I hope I've given you a flavor of something that you may want to go and discuss with your GP, or visit the Diabetes UK website. So if you Google Diabetes UK, they've got lots of resources and information about